Hi everyone. Hello everyone. Happy Friday. Happy almost spring. Dr. Amin here from Toronto. Another beautiful day to go live and talk about women's health, perimenopause, menopause, and hormones. If you hear me, thumbs up. And as usual, if you have any questions, you can drop it in the comment or the question bubble. We're going live today with Dr. Roberts from the UK, England, and we're going to talk about all the very evidence-based latest advancements in women's health. Great, thank you. Let me know where you're coming from and how things are with this day, night. Thanks, Lawrence. Thanks. Great. Definitely. So let's go live. I'm going to invite Dr. Roberts. Just a second. Hello.
Hi. Good
Hi.
evening.
Hi. Good afternoon.
How are you?
Good, good. So thanks for coming here today. Good to
Oh,
have
thank you.
you.
It's my pleasure. I'm thrilled.
So how do you like me to call you? Dr.
Oh,
Roberts?
Resh. Call me Resh. That's what everyone
Resh.
calls me.
Good to
My
have
mum
you,
calls me
Resh.
Reshma when she's angry, so don't call me Reshma.
Resh. Lovely to have you here. Okay, so before we start, shall we introduce ourselves to the viewers, please?
Yes, well, my name's Reshma. I'm a GP in the UK, NHS GP, and I've got two kids, two girls, lovely girls, and a husband who's also a doctor. And yeah, I am a menopausal woman. I have struggled with menopause and have kind of been lost with all the sea of information. So I've kind of decided to do my own research and now kind of try and help women navigate menopause with lifestyle advice mainly. But yeah, it's been a challenge. It's been a journey, and I've learnt a lot along the way, more than I would
Mhm.
have at university, that's for sure.
Yes, that's so true. And I'm Dr. Amin Bahar, and I'm a GP from the UK too, now practicing in Canada, Toronto. I have twin girls, so I have two girls too, and I'm going through perimenopause. So it's a journey for me. It's a learning curve every day with all the changes noticing in my body. And also last 6, 7 years, I become board certified in functional medicine, metabolic, regenerative, longevity. So I do have a clinic, a wellness clinic, focused more on women's health, but I do see men as well.
That's fascinating. That really
It
is.
is. It is fascinating. I always say it's an exciting time to be in medicine, practicing
Yeah.
medicine. Even more so exciting for people individuals who want to take charge and control of their health. It's just great times.
And I think functional medicine's become quite an exciting field, hasn't it? Um,
Mhm.
I'm learning so much more about it. And again, not from university, but by doing your own research, yeah, it's I honestly, it's an emerging field, isn't it?
It is. It's very interesting. I mean, talking about the gut health and connection between gut hormones, doing all the functional labs and tests. It's another world. And then it is advantage to me to have the tools from the both sides in my toolkit. So it's great, conventional and functional, mixing it, and yeah, it's great.
So how did you go into it?
So I mean, it started with me seeing. I mean, for a few years, I wasn't feeling very well, the best myself. So I was searching up everywhere for answers, and not getting that from my GP or a specialist. And then I had a patient, interestingly enough, who told me that she is with this arthropathy, psoriasis, going to the States to see this functional doctor. So that was the first time I heard about functional doctor and all the tests and learned about it. And I then went through the whole course and different modules through A4M in the States. And I did it was big. I mean, it took me about 2 to 3 years to do the whole exam and go through the modules, but it was great.
So do you do any general practice
I
now?
do. So I still have my GP practice. I see patients on national health, and then beside that, I have my wellness clinic, private.
Amazing.
Hmm. It is. It is. I mean, back old days when I was in the UK and I became a GP, at that time still it was all national health, but I do know that you have private too now.
Yes, we do. I mean,
Mm,
I don't do private work, but I think the NHS, as everyone knows, is going through a very difficult time at the moment,
mhm,
which brings its own challenges. It's not an easy job to do, but we do our best. But yeah, it is hard. I mean, I'm part-time, so I
mhm,
don't work every day,
mhm,
but the days that I do work are pretty full on.
mhm. So let's dive into juicy part, and that is hormones, and it
Yes.
is menopause, perimenopause. So tell me, what do you normally do? I mean, how do you diagnose? If is there a test you do to diagnose perimenopause? For example, a woman comes to you in late 30s, early 40s, complaining of sudden onset of anxiety, depression, and sleep problems. So what do you normally do, and how do you approach such case?
I mean, normally it's a full-on history taking, isn't it?
Mhm,
You're asking about all the other symptoms, the changes in their periods, other symptoms such as the vasomotor symptoms, like the night sweats, the
mhm,
flushes, um, and I mean anxiety, as you just said, is huge in people who suffer with perimenopause. As is brain fog. A lot of women complain of brain fog. And often the kind of arthralgia that comes with it, the aching in the mornings, the stiffness,
mhm,
and it's really about teasing out the symptoms and trying to explain them. And if they're in their late 30s, I would always be looking for other reasons.
mhm,
But if I couldn't find another reason, then obviously it would be menopause or perimenopause. And obviously, as you know, we deal with early menopause, premature ovarian insufficiency,
mhm,
differently to people who are perimenopausal. So, most of the time, if I'm convinced they've got HRT, I mean, we don't do bloods in the UK. It's not
mhm,
recommended unless they're under the age of 45. If you've got a fairly convincing history. But mainly because, as you know, the hormones fluctuate so much that you
mhm,
can't actually get a moment in time as to what's going on. So I don't tend to use it unless they're really young. Um, and if you explain to patients, most of the time they understand. So I mean, I'm very keen on HRT. I give it to most people unless there's a contraindication. I think since I started reading about menopause, the way I manage other women has changed massively. I think I probably was one of those doctors beforehand where I'd say, "Oh, look, all your bloods are normal. There's nothing wrong with you."
mhm,
But now I'm a lot more kind of tuned into, menopause, late 30s, early 40s. Is it menopause? And most of the time it is, to be honest.
mhm. Yes, it's very interesting. I mean, I agree with you. So I normally go by ruling out other possibilities, thyroid disease, iron
Yeah.
deficiency, or other possibilities. And thereafter, if nothing, we not find anything, then it's probably likely to be perimenopause. Very commonly we see. And now it's interesting. I was looking into that data and all the numbers. We see like women about 80-90% of women experience menopause symptoms, but maybe just 30% come and seek help or talk about it
Yeah,
even. So that's so significant. We
I
see it
know.
still in this day and age.
I know, and it's not
Hmm.
talked about. I definitely think that the dialogue is changing. I think women are more proactive because obviously most women do have social media, and they can see, the kind of the transition is that where our parents or mums wouldn't talk about it, and they would kind of silently suffer with hot flushes. Whereas
Hmm.
now, if we're all suffering with hot flushes, the clothes are coming off, and we're kind of quite open and and talk about it more, don't we? We suffer with everyone, or everyone has to suffer with us. So I think it's quite nice that we're kind of a bit more open about it, and it's not so taboo. But there's definitely more work to be done, without a
Hmm.
doubt.
Yes, I mean, it's great that we have these platforms nowadays, daily educations, evidence-based, for public, empowering public, but still a lot of people are not aware of those symptoms or just shy away from it or
Yeah,
still maybe scared. And there's so many specialists and doctors still not keen even talk about HRT hormones.
it's funny, isn't it? I mean, I've seen a few women recently who come in and they've got all the classical symptoms. They're in their early 40s, and you're sitting there and you're thinking, this is perimenopause, and then you kind of ask them to reflect on it, and what do you think this could be? And they a lot of them don't know, and whether or not they aren't possibly being honest, and because the word menopause has got so many negative connotations, hasn't it?
Mhm.
It's almost like in the past people have assumed that the menopause is the beginning of an end. Does that make sense? And so even kind of you know having that kind of acceptance that this could be perimenopause, I think a lot of people
Mhm.
just go into denial, actually.
Yeah, maybe they don't want to accept.
Yeah. But I think, again, the narrative has to change with that because it's not the beginning of the end. It's the beginning of a new beginning, I think.
Yes. Yes. It's probably one third or even two-thirds of our life still
Yeah.
goes in menopause. So that again, that's another question. What's the biggest misconception about perimenopause and menopause that you hear from people?
I mean, I think a lot of people think that perimenopause is just the end of your fertility world, isn't it?
Mhm.
I mean, if you think about what estrogen does and how it affects your body in so many ways, your brain, your heart, your bones, your muscles, you can't just look at estrogen as a sex hormone. I think that is really underestimating its value as such. And so, that's why it's almost like a multi-system disorder, isn't it? It affects you in
Mhm.
every single way. And I think, yes, I mean, a lot of women can feel it's almost like the loss of not being able to have children, but all the other stuff that comes with it and all the things that perhaps need to be focused on as well as, in terms of their future and their longevity and their kind of future health. I think, it's really important that women know that it's can affect their cardiovascular disease profile. It can
Mhm.
affect their bone health. It can increase their risk of falls. And I think having that message and putting that out there is really, really important. And that's where I feel really strongly about that, knowing that those statistics actually are there. And what can you do about it? How can you reverse it? And try and be proactive about it now.
Mhm. Yeah. I mean, one of the biggest misconceptions I hear is that of course, this is a transition. This is menopause, and it passed, and we can just sit and suck and do nothing about it. But this is totally wrong. This is
Yeah.
not going to pass. This is a phase. This is a state of hormone deficiency that we're going to live with it for the rest of our lives. And unless we want to take call and do something about it.
Yeah. And I think, if you give people the information of what potentially could happen, it's completely up to them then. But having that information, I think, is really, really empowering and powerful. Nobody needs to be forced to do something they don't want to do, but at the
Mhm.
same time, I don't think women are that's not talked about enough. I don't think what the lack of estrogen does to you long term. I don't think it's in the forum, in the arena as much as it should be.
Absolutely. I always say, as long as it's in informed
Yeah.
decision making. That's absolutely fine. So everyone's right to decide, and it's their choice to do whatever they want to do. But this is just awareness to know about all these changes and things that are available to them to uh, hopefully deal with it in the best way.
Yeah. So that's where kind of I think lifestyle comes in a massive way. I mean, you know, this is what, I try and kind of encourage women to do is look at their nutrition, look at their exercise, look at how they manage their stress, and all these things will have, an additional compounded effect on their kind of ongoing future health, I mean, we know muscle declines, don't we? And, if you lose muscle, you lose the ability to be able to stand up straight and function and not be able to kind of live independently when you hit your late 70s and early 80s. And I think just by focusing on things that, increase your muscle mass, are really, really important. And again, I think people do know this, but I don't think it's as well known as I'd like it to be. I mean, I start talking to my patients about lifestyle if I see them in their perimenopausal kind of zone. I always talk about, what can you do now? And, the vast majority of them don't know and are quite willing to make changes because they want to have a good, healthy future, don't they?
Mm-hmm. I mean, hear about weight. I want to lose weight. Then I say it's more important to think about body
Yeah.
composition and your muscle. You want to increase that muscle mass and strength rather than losing weight. So that's again another way to talk about body composition, which will significantly impacted by hormonal changes during perimenopause and menopause.
Yeah.
We see that shift.
And the added bonus is if you're building muscle, you'll lose the weight as well. So
Yeah. Yes.
two for the price of one.
Exactly. So I see your clips, and you pretty active with your weightlifting and exercise workouts. So what do you do, and how do you explain that to your patients?
I mean, I mean, my story is a couple of years old now. So I've started from not being able to do anything to now using complicated machinery. And I think
Mhm.
if you're going to try and encourage a woman to start resistance training, the first thing I would recommend is they start using their own body weight, or even a can of baked beans,
Mhm.
just to start lifting and pushing and squatting and lunging, because those are really effective ways of getting your muscle warm and getting going. And then eventually you'll get to a point where you'll want to use hand weights. And maybe then you'll want to use a gym. But it's a process. No one expects you to kind of go straight into a gym and go for the really complicated, scary machines, because that's not how it works. And you need to be able to do it properly. So I think investing in a PT, if that's possible, is definitely worthwhile because
Mhm.
number one, they show you how to do it and to do it effectively and also to do it safely, because you can injure yourself. I mean, some of these machines are really heavy, and even I've had falls.
Yeah. Yeah, definitely. It's good. It's a very good investment, as you said, to have that personal trainer.
Yeah,
Hmm.
without a doubt.
Yes.
Um, because it gives you so much confidence, and then you can walk into a gym and you can go to the big boy machines and you know what you're doing, which is quite a nice feeling.
Mhm. So now, what are the symptoms of perimenopause? What very sometimes we hear very strange symptoms and presentations. What have you seen in your practice, or how do you explain your patients about those symptoms?
I mean, are you asking about the
The
weirdest symptoms I've seen?
weird, not that common ones.
um I've seen a woman with asthma. I've seen, obviously you see the allergies, they become quite apparent, don't they?
Mhm.
Itchy ears, grinding teeth. I had that, and I still do. Um, Dry skin is quite common, isn't it? I think that just comes with
Mhm.
aging, unfortunately. But it's probably the itchy ears and the asthma that I can think of that kind of strikes me the most. What about you?
Yes. Yeah, I heard about itchy ear, and that's again probably dry skin, burning tongue, and then electric shock
Yeah.
waves. Yeah, I had that, pins and needles, tingling on skin, and some people, interestingly, I hear about smelling odors that other people cannot detect. That again, a
Yeah.
lot of times, very commonly, I hear now more and more. So these are very strange, not that common. But then there are common ones like anxiety, depression, bloating, weight gain.
Yeah. Mood
Mhm,
swings,
mhm,
PMT,
mhm.
rage. There's so much fun to come, isn't there? So
Yes.
much fun.
So how to deal with those fun stuff that are coming our way, how to naturally uh, optimize our hormones, especially I know in the beginning, early stages of perimenopause, there's so much things that we can do to naturally optimize hormone levels.
I mean, I definitely think, your exercise levels will improve. If you improve those, that will improve your general well-being, your mental health, but it also helps you to sleep, doesn't it? We know
Mhm,
that it's been studied to death, and that's been definitely a proven thing. But I think one thing I would stop perhaps doing is looking at kind of inflammatory foods. So things like refined sugar, I would avoid ultra processed food and
mhm,
try and cook from scratch, make a meal with real ingredients rather than grab a takeaway or something from, a big fast food chain kind of shop.
mhm,
It's so easy and we're so busy as women, often we have jobs, we have young children and we've got pet parents that we're looking after. And so, we're always the last person to look
mhm,
after, aren't we? We
mhm,
never think of ourselves. And I think just by just making small changes, and a lot of the time I encourage my clients to just meal prep, at the weekend, just plan your meals so it's not overwhelming and you know what you're eating, freeze them, defrost them the night before, and then at least then you're having something good. And it makes such a huge difference in terms of your energy levels and your sleep, and it certainly has for me. Um, I mean, I do, there are things that, anti-inflammatory diets and phytoestrogens, definitely things like fiber.
mhm,
All of these things will improve your kind of gut health, but I don't know whether they'll ever replace, your full quota of hormones. And so, I advocate HRT if it's possible,
mhm,
because why shouldn't you?
mhm.
Um, if a man hadn't low testosterone, they'd get testosterone, wouldn't they? And so, you're only replacing something that they don't have. Obviously, it's not safe in some women, but yeah, I'm very proactive about HRT, to be honest with you. I'm not sure how much lifestyle will be able to improve things in terms of everything that it does, or the lack of estrogen and progesterone.
Yeah, I mean, certainly, early days, as I said, in perimenopause, it may help to some extent. And of course, we have to continue with that lifestyle modification for the rest of our lives. That has to
Yeah.
be part of our life, regardless of hormones, to stay healthy, work on our stress, sleep, diet, and workout and exercise muscles. But of course, as you mentioned, nothing can replace hormones that already is gone. So we have to replace them when it's needed and when it's safe, which is most case, I think, benefits outweigh the risks in most of women.
Yeah, absolutely.
Mhm.
I mean, do you give HRT quite a lot in Canada?
Um, it's getting better. More people, at least they come and talk about it. They're more open to hear about the benefits and just check what are the differences, what types of hormones available, and At least they're more open to more local and vaginal estrogen, which again, there's so many benefits,
Mm.
not only just to for vaginal atrophy and improvement of having the quality of sex, but it's important for later in life prolapses, incontinence problems. So all
Yeah.
of those so important. UTIs, recurrent UTIs. So I think they're it's getting better. The word is out there, and people are come and ask, and then I see more women who are willing to try and have, and then significant day and night change and improvement with those symptoms. There
Yeah.
is no doubt about it.
I mean, how readily available is HRT? I mean, obviously in the UK, I think it is quite readily available. I mean, do you find it less readily available than your experience when you were in here?
No, no,
Okay,
it's
so
yeah,
similar.
yeah. There's pretty. We do have most brands, pharmaceutical brands, and then there are less women interested in compounding, but there's some who have to go compounding. There's no other way for them. They have allergies they cannot tolerate, so that's the last resort to go and have the compound HRT for those women.
Okay.
But it's pretty available, and um, now, as I said, more women want to try and have it. That brain fog, for example,
Yeah.
the brain fog, and
Well, I think that's one of the hardest things, isn't it? You get a fully functioning woman with a really responsible job, who wants to consider, leaving her job or demotion because she's just finding the stress of her work just too much. Um, and I did a reel about this yesterday, and I think because it was I thinking about a patient that I'd seen, and it's so hard to we know what it's like, when you kind of can't remember that word, and that feeling of just loss of control is actually quite upsetting, isn't it?
it
Because
is.
we're bright women, and then all of a sudden
Mhm.
not being able to think of the word, I don't know, just I can't even think of the word now.
Exactly. It is. It is just like that. Or many times it's happened to me walking in the room looking for something, but no, I can't remember what it was, what I'm doing here. So that happens more and more and more to the point that you think, am I
Yeah.
going crazy? Is this
Yeah.
dementia beginning or something? But now with work of experts like Dr. Lisa Mosconi, who's
Yeah.
yeah, the charge in all those medical advancements and how hormones impacting your brain and whole body. It's just amazing what all these research is going on.
I mean, what she does is fantastic,
Mhm.
isn't it? It's and I think this is the thing, isn't it, with when it comes to menopause, is that when you're reading about it and studies, the conclusion is always we don't have enough information, we don't have enough data, and that's I feel quite it's sad in a way because we've got some data, but the data's not robust enough for us to be able to make an informed decision. Even in with HRT now, I'm doing my British Menopause Society accreditation at the moment, and
Mhm.
the at the end of every single paper is we don't know enough, we don't know, and it's really hard then, isn't it? To Because some studies say yes, it's okay, some studies say no, it's not okay. So then we don't know enough. That's it. I find that really upsetting, and hopefully that will change. So what Dr. Mosconi is doing is fabulous, and hopefully that will continue.
A question here. What about HRT for 62-year-old with hypothyroidism?
What's starting HRT? Um, I mean, you could have it as long as there's no major contraindication, but I think there's that kind of safety window, isn't there, of you're probably more likely to benefit from it if you take it within the first 10 years of when perimenopause started. So usually 62, you're kind of postmenopausal, aren't you? How much benefit you'll get is difficult to know really without your medical history. But I mean, it's not an absolute no-no, but I don't think you'll gain as much benefit from it than someone who was 50 would get.
Because we keep hearing about this 10 years from menopause. Again, depends when she
Yeah,
has gone menopause. So maybe if it's like 55, 56, you're still in that 10-year window. But again, as you mentioned, it's very personalized. We have to go assessing each case.
absolutely.
So many risks and benefits, and in many cases, as I said, it's having it is better than not having
Yeah.
it.
And I often have patients, and you're probably the same, who are in their 60s and they don't want to stop their HRT. And, who am I to stop it? It's again, it's an informed decision. You tell
Mhm.
them that this is sometimes there are risks now. We are entering that zone where we don't know enough, and there are potential more risks. And most women are happy to accept that, and because they don't want to lose their quality of life, which I think is more than reasonable, to be quite honest.
Mhm. Yeah, I agree. I totally agree. And then there are all different, I mean, I do so many different functional tests, like checking again cardio metabolic risks, um, advanced lipids. So those are things that I do like to check and then make sure one is safe to be on hormones and we continue. It's absolutely fine to continue because it's the quality of life and especially with bones, with brain, hot
Yeah.
flashes. Sometimes women keep having hot flashes and night sweats all the way in their 70s. So we can't just all of a sudden because they hit 60 stop.
Yeah.
That's not right. Mm-mm.
Because this person has a life, and some of these symptoms can be really, really distressing. And yeah, I don't stop it. But I think that study that where everyone all of a sudden stopped giving HRT kind of made such a massive kind of impact or negative impact on how HRT was prescribed. Because when I qualified, we didn't really get any training on HRT. All I knew was HRT is not safe. Don't give it.
Yeah.
Um, and so it's nice that the journey is progressing and we are moving on and things are changing. But yeah, there's still more to do, isn't there?
Yes. We have so much work to do, but it's just great. I mean, I love every second of this journey, learning about hormones. As you said, we never had that training in medical school, so it's on us to learn about it and just hopefully empower women and just spread the information out there.
Absolutely. And that's what we
Mhm.
do every day, isn't it?
So another question about strange symptoms. I face weakening legs along with hot flashes. Yeah.
I mean, your hot flashes, they're probably going to be perimenopausal. There's not many other things that can do that. But, I don't, unless you've been to see you're a doctor and had that looked at and tests done, it's so difficult to advise you. I certainly wouldn't want to say to you, oh, it's perimenopause,
Mm-hmm.
ignore it. I mean, I think if you've not been checked over, I would definitely urge you to do that.
Yeah. Yeah. Because that definitely I haven't seen any issue with the leg. Uh,
Yeah, I mean, you can get kind of nerve system issues, can't you? Like you mentioned the electric shock
mhm.
thing, but it's so difficult without medical notes and not having your story with to guide you. So I think it is definitely something I would go and get checked out.
Definitely. I mean, I definitely see, and we know there's studies show that more autoimmune disease as we
Yeah,
get older in women, of course, and as we go through menopause. So we have to make sure about autoimmune disease as well. Like hopefully not, but you want to rule out all
yeah.
the.
Yeah, I mean, you've Googled it. I mean, I don't trust Google, if I'm honest. Um, so I
Chat
wouldn't, I
GPT.
just, yeah, I wouldn't just go with that. I would, yeah, definitely get it checked out. That would be my advice. I'm 59 and started taking hormones, but after a few months had some bleeding and have been told to stop medication straight away. I mean, again, it's so difficult to inform somebody about this when, you don't have their records. There could be real valid reasons that they've told you to stop it.
Mm,
Uh, it is difficult, but you can get bleeding when you start HRT.
mhm.
It, it's Are you having tests? Have it's really difficult to know how to kind of inform you, unfortunately. Sorry, not being very helpful here, am I?
Yeah, I mean, we know in general some people may have spotting or bleeding in the first few months starting HRT, but um, always discuss and seek medical attention with your health provider. Make sure everything's safe, you're
Yeah.
healthy, and everything's good before continuing any kind of treatment.
I mean, if you're going to get irregular bleeding with HRT, it's more likely to happen when you start it, isn't it? It's not going
Yes.
to, it'd be unusual for you to have no bleeding and then all of a sudden bleeding. So there may well be a valid reason that he or she's told you to stop it. Like I said, you normally get bleeding right at the get-go of starting HRT, and usually it settles down. And if it doesn't, that's when you need to be investigated.
Mhm.
Um,
What about sleep problems? Do you have any, how do you approach that? Uh, of course, progesterone helps a lot with oral progesterone micronized helps with that GABA effects. But any other suggestions, supplements or foods, nutrients you ever suggest to help with, or
um,
medications?
I mean, I take magnesium. I find that quite helpful with sleep.
Mhm,
I wouldn't really recommend anything else in terms of a supplement, as well as obviously HRT. But I mean, what's keeping you awake. If you're finding that you're needing to go to the toilet and that's what's keeping you awake, then maybe stop drinking after, say, 6 p.m. Don't have
mhm,
too much fluid. If you're someone who's quite stressed, maybe look at stress reducing activities. So journaling is really good.
mhm,
Making sure that you're active, walking is really good for stress and sleep. So a lot of it will be kind of tailoring it to the individual and making sure that you're kind of ticking the boxes that are causing them to not sleep well. I mean, the other thing is, if you're in a really hot room, you're
mhm.
not going to sleep because you'll end up having hot flushes. So make sure that you've got a cool room, um, and try and kind of do some stress reducing activity before you sleep, so you can just kind of almost put a closure to the day and you're not thinking about it too much.
Mhm. Good.
What do you tell your patients? What do you say to them?
Yeah, same. So it's good to have always a routine, sleep
Yeah.
hygiene and routine, and stay away if possible from watching Netflix before bedtime.
Digital detox. We're all on our
Prime
phones, aren't
series
we?
just to get, yeah. And then gradually, it's again another thing that we always discuss is having that light in the morning. So to help that balancing your circadian rhythm, you want to gradually slow down cortisol, and melatonin goes up naturally and in the morning by having that light. So a good night's sleep, I always say, starts with a good morning ritual and habit, and that's having that daylight, walking, having, as you said, mindfulness. Those are so important. Balancing stress and balancing your circadian rhythm, it certainly helps, but not always. I mean, some people come to me and say, Doctor, I mean, we've done all of those things that you mentioned, but still we're struggling. So, but many cases, progesterone helps with sleep too. Hmm.
Yeah, we haven't had much daylight recently. It's starting to get light now, but the sun was coming up at 8 o'clock at one point, so that daytime sunlight
Yeah,
was quite difficult, especially in women who work. Unless you get one of those,
light
fake. I
boxes.
can't remember the name of them.
Yes.
That's it. Yeah,
Yeah.
yeah. I
Yeah,
don't know
you can
how.
buy them from Amazon and you can leave it on the whole day, especially on the short days in winter. That's good. That's helpful.
Okay.
Hmm. Hmm. Yes. And then I worked a lot on cortisol, checking the cortisol, and that is with certain functional lab tests and balancing cortisol. We have many women during perimenopause and menopause with so high levels of cortisol or flattened curve of cortisol. So I do work a lot with that. With supplements and adaptogenic herbs, which is really helpful. I mean, in many cases, in the start of perimenopause, hot flashes, just balancing your cortisol helps without
Yeah.
starting HRT. That really helps with that hot flash and night sweat too.
That's
Hmm.
interesting because we don't have access to things like cortisol blood tests.
Hmm.
In my work environment. So it's not something that we can actively test for. But yes, you'll talk about reducing cortisol, reducing stress to patients because obviously you kind of assume that their cortisol is up.
Hmm.
So do you with their cortisol, do you kind of depending on the result give them different types of advice, or if it's high, this is the protocol you use, and if it's low, what do you do then, or is it very rarely low?
It's rarely low. It's rarely, I mean, there's a beautiful curve we see on the picture of the, when we do the 4 point, we say cortisol levels, and has a beautiful curve, and sometimes it's gone flat, and that's the worst. That means that for longest time, someone has been in that fight and flight stress state. So that takes longer for people to recover, and we have to work longer. Hmm.
God,
It's not that easy, but it's very interesting. And
yes, fascinating.
mhm.
Yeah. We're very we don't have functional medicine really in the UK. I mean, if it is, it's a private clinic.
It
It's not
is
something that
private. It is
yeah,
private, and most of these tests are done in the States. So even I order tests from States,
right.
and not here in Canada. We don't have much access, not labs who have those functional tests here.
Okay.
Mhm. How do you treat paresthesia, which is symptom during menopause? I do agree. It is that pins and needles and tingling a sensation. I do see again a lot of women responding well with HRT, but again, it's important to rule out Hashimoto's. I had a
Mm,
few patients with just positive thyroid antibodies and having that paresthesia during perimenopause. So again, trying working on balancing diet,
yeah.
not just giving hormone, thyroid hormone to these patients, but I work on limiting their iodine intake, and that sometimes helps. It helps with that
Okay.
pins and needles and tingling. Hmm.
Yeah. What supplements would you recommend to balance the cortisol? Um, I'm not sure if there are any supplements that you can use to balance your cortisol, are there? Other than you mentioned your adaptogens.
Yeah,
I
I
mean, a lot of
love
this
that
is
calming
stress.
herbs.
Yeah.
Hmm.
Reducing stress and looking at activities that try and reduce your stress. So, things like yoga,
Hmm.
Pilates, things that, calm you down.
Yeah, activating that vagal tone,
Mm,
humming, deep
humming. That's
breathing.
it.
Yes,
Yeah.
those are really good stuff. Hmm. Yes. And what's the first thing they should do if someone start improving, they want to improve their menopause journey today? What do you recommend? Any?
I mean, there's so many things. I could talk about this for ages. Um, if there's any one thing that you could start doing today is just start moving. just move your body. I mean, it's a process, as I said earlier, just go for a walk, even if it's 15 to 20 minutes a day, start walking, and then progress to using some sort of resistance training, even if it's a band of some sort. I really do think that bone density and muscle really, really needs to be thought about really seriously, because it has so many negative effects on a woman in later life, that whatever you can do now, you know, start now, basically.
Mhm. Move, move. For me, I love sleep. I mean, my sleep was affected badly with perimenopause and hormone imbalances. So it was difficult to adjust sleep, but that's my number one.
Yeah, I know. And again, it's a very personal one, isn't
Mhm.
it?
It is, certainly. And I see many women complaining about um, gut health problems during this time, bloating, constipation, IBS symptoms, irritable bowel syndrome. That is, again, very common, I see. And that is due to hormones. We didn't ever think about hormones can affect our gut, but it's such link between hormones, sex hormones, especially estrogen, and gut microbiome.
Yeah.
So, mm,
And again, that's a really exciting new field, isn't it? The stuff that's coming out now about the gut-brain axis and how they're interlinked is really, really good. And, is one of my big interests. Fiber,
mhm,
get your fiber in.
yes,
Probiotics are the
fiber,
best.
yes, and lots of foods, vegetables, fruits and vegetables, definitely.
Yeah.
Broccoli, cauliflower, Brussels sprouts. Those are amazing for metabolizing your hormones too.
Anything that
And
has color.
detox, yes, yes. Detox, something that we, I mean, living in a environment full of toxins and hormone disruptors. So it's important to, as well as getting your hormones, balancing your hormones, working on your detox pathways too, your main organs like liver. We want to work on liver detoxification, and gut again. So those are two main organs for a detox. So we have to
Yeah,
work on the health of
yeah.
those. Hmm.
Oh, it's fabulous, isn't it? It's fascinating.
So one last piece of advice for the viewers, and we can't wait to hear you.
My advice.
Your advice for all of us.
You know what? I just think that perimenopausal women just don't look after themselves enough. I just don't think they give themselves enough time in the day. And I think if there was one thing I'd say to you, is just give yourself 5 to 10 minutes of your own time. Walk away from everything. Just sit, read your book. I don't know what it is that gives you joy, but just do it, because you know, you have to be healthy to look after other people, and people that rely on you are not going to be able to get things done if you're not well. So, you've got to look after yourself. I'll talk about protein, I'll talk about lifestyle, I'll talk about that, but you've got to just make sure that you do something for yourself. And that would be my biggest advice to you.
Bravo. The best. It's so true.
Yeah.
We forget to look after ourselves, even 10 minutes, and have that boundaries. Start to work on that. It's an amazing step. Hmm.
Yeah.
Definitely. My piece of advice is to grounding, do grounding, go out bare feet and just have the energy from ground, from earth. That's
But you,
my.
but you live in Canada. It's probably warm there, and here it's freezing.
It's not. We have freezing winters in Toronto. We
Okay.
minus 20, 30. No, no, not the winter time. Please don't do that. When the weather is better now, you can go out bare feet and do grounding for a few minutes.
Okay, in the summer I'll do it then.
Resh, it was lovely chatting with you,
Um,
talking. It was great
you.
meeting you, and hopefully one day in person I
Yes,
meet you. Yeah,
yes. Keep
maybe
me informed when
soon.
you're in the
Yeah,
UK
yeah,
next.
yeah,
Yes,
yeah.
and
And
thank
you
you
should
so
come
much for
over.
inviting.
You're
Yes. Well, I have
welcome.
a cousin in
Thanks.
Toronto, so
Ah,
I have one day I'll plan
so
and I'll
there
let you know for sure.
we go. No excuses. We wait for
I
you
know.
here.
Thank you so much for inviting me. It's
You're
been a
welcome. It
pleasure.
was a pleasure. Great to see you. And thank you everyone for being here with us today.
Thank
Bye.
you.
Bye bye.
Bye.